All right, guys, I want to talk about a couple common, relatively common scenarios a lot of people often ask me about carnivore diets and certain conditions. So we're going to talk about gout, we're going to talk about people that don't have gallbladders, and we're going to talk about people that have established heart disease, because I think they all deserve some individual attention outside of the normal sort of talking points on how one might implement a carnivore diet. So first of all, gout, as you guys may know, is basically an inflammatory condition that tends to often affect the joints where it's very painful. A lot of people, it's often noticed in their toe, but it can affect really any joint. And it can also end up in, you can get skin nodules called gouty tophi, which are like a collection of crystals. They actually look like a bunch of toothpaste. Actually, I've operated on many of those. And so gout is associated with high levels of uric acid, right? But that's not the only thing that occurs in gout. In fact, gout is probably, and there's a lot of evidence to point that, another sort of manifestation of just general metabolic disease. And so there's a really high relationship between the people that have been formally diagnosed with metabolic disease and the percentage of people that have gout. In fact, every patient I ever took care of with gout had some form of metabolic disease, often diabetes. And so what happens is these people that develop symptomatic gout, that is swelling, pain, deposition of crystals and things like that, usually have a number of things going on: metabolic syndrome, diabetes, hyperglycemia, insulin resistance, on and on and on. And while they are in that state of insulin resistance, metabolic disease, if they consume foods that raise their uric acid, and meat can potentially do that due to the fact that it is high in something called purines. Purines are part of the DNA structure. All foods have purines in them, but meat has a little bit more DNA than, say, a piece of lettuce might. So you might see an increase in your uric acid sometimes. Now, that uric acid elevation doesn't always lead to gout. These other things have to be in place, and it's more than just a metabolic disease. There's an immunologic component. There is a pH component, there's a temperature component, there's probably a microbiome component, to be honest. And so how do you deal with it? So if you have gout, and I've seen lots and lots of people with gout go carnivore, and they never have a gout flare, and their gout goes away, and they get metabolically healthy, and they're great, fine, that's awesome. Occasionally, you have some people that are really metabolically sick, they'll start carnivore, and their gout will flare up. So how do you deal with that? Well, what I would suggest is, you probably are on some sort of medication for gout, and you just continue to take those medications for the 2, 3, 4, 5, 6 months that it takes for you to metabolically become healthier. I think that is a reasonable strategy. I would say probably 25% of the people with known gout will precipitate a flare while transitioning to something like carnivore. So that's to be mindful, but it generally gets better, and rarely does it occur later in the game. So that's some of the overall thoughts on gout. One of the other things, with regard to uric acid, we know that going into ketosis, the uric acid is excreted by the kidneys, and ketones tend to compete with that, and so we have a little bit more, uric acid floating around. All right. So short answer on gout: you can do carnivore. Just if you need to, take the anti-gout medications, whether they be colchicine or allopurinol or one of the anti-inflammatories, which are typically utilized. All right, second condition is, what if I don't have a gallbladder? Dr. Baker, I don't have a gallbladder. What can I do with all that fat? Well, first of all, why do we have a gallbladder? Well, as you guys know, the gallbladder stores something called bile. And what does bile do? Bile acts as a emulsification factor, like soap. Like when you mix, anybody's ever put like fat grease in the sink and they pour soap in there, you see how it just disperses. That's what bile is doing. It is acting as a detergent to break down fat globules into smaller pieces so they can be absorbed by our intestine. And so if you don't have a gallbladder storing bile and squeezing that bile out, does that mean you have no bile? Well, of course not, because our liver makes bile. And while the gallbladder stores it over here, the liver produces, and it goes down something called the common bile duct, and then the cystic duct from the gallbladder joins that, and then both of those together enter into the small intestine and the duodenum through something called the sphincter of Oddi. Well, what happens is, chronically, if the gallbladder's gone, the liver is still producing all this bile, and it starts to build up, and that little duct starts to expand a little bit. So it starts to act like a secondary gallbladder. So you still have this bolus of bile waiting for that sphincter to open. So Initially, like particularly if you've newly had your gallbladder out, it takes time for that to adapt. But also initially when you go on a carnivore diet, one thing you may have to be mindful of is just how much fat you consume in one meal. You still may need to eat a lot of fat because you need energy, right? But in one meal, you might find that you have to eat smaller amounts and then you have to eat multiple meals a day to get that fat total up to where it might need to be so you have plenty of energy. Remember, without carbohydrates, you run on fat and you need fat in your system. Okay, so that's a consideration with gallbladders. I have yet to see somebody have any significant problems long term that don't have a gallbladder. You know, initially there can be some diarrhea and things like that, and some people will consider taking different enzymes, you know, whether it's pancreatic enzymes, lipases, and things like that. Those can be helpful, but the short answer is you can definitely do carnivore without a gallbladder. There's many people that will attest to that. Now, the third condition, which is probably the most controversial, what if you just had a heart attack? Or what if you've got a calcium score that's super high and you know you have heart disease? Can you still do carnivore? Well, the answer to that question is yes, I think you still can. And certainly there are people that do that. But I think there are some really important caveats here. And so if you know somebody that's considering carnivore that's had heart disease, or you yourself are, this is how I would approach that. So I don't think we're at a point in 2024 yet where we can just say cholesterol doesn't matter, and cholesterol, particularly on a low carb diet, just doesn't matter at all. I think we're not quite to that point yet because, again, just like I talked about with gout, you still have this. If you've recently had a heart disease, you know, recently, like within the last couple of years, you may still be metabolically compromised. You may still be pre-diabetic or obese or hypertensive. If all those things are still in place, and I think you do have to be cautious around how high your cholesterol gets. You know, I think that's a reasonable, you know, way to approach this. And so what could you do? Well, you know, potentially, I mean, a lot of people say, well, you could just take a drug, statin drug, PCSK9 inhibitor, azacitidine, things like that. That's certainly a valid approach initially, right? And then as your metabolic syndrome gets better, as your diabetes improves, as your hypertension improves, as your body composition gets better, then you may be at a point where you maybe no longer need those medications. I think that is a very reasonable way of doing things. I think you could also transition into a low-carb diet of some other sort for a period of time to hopefully work on some of those metabolic factors, again, so that you can maybe be safer to tolerate higher levels of cholesterol. Again, having high cholesterol in 2024, there is increasing evidence that that may not be a problem. Can we say that definitively? I don't think we're there yet. I think we may get there. So, I mean, you know, just keep watching this space. I mean, some of the work that's coming out will be published this year is going to be interesting in that regard, but I am a long way from telling people just don't worry about it. And I think that would be a little bit perhaps even unethical, you know. So anyway, so some thoughts on that. You guys have a wonderful, wonderful day. It is day 13 of World Carnivore Month. Hopefully you guys that have joined us for the first time are having a good go of it. If you're struggling, you know, let us relate in the comments what your struggles are. Maybe somebody, if I don't get a chance to comment, we'll give you some guidance in that. All right, guys, the other thing I want to mention is I'm excited to announce that Rivero has opened. We are now accepting our first patients off the waiting list. There are something like 6,000 people on the waiting list, so we'll be reaching out to, you know, almost everyone on that list to invite them to formally apply for the program. So I'm very excited about that. Again, we are going to change the way healthcare is done. We are going to put, you know, the actual, you know, causes of disease and figure out why somebody's sick, not just here's a pill. All right. So anyway, so wow, this is how healthcare should be done, in my view. And I'm excited to be part of that. I'm not just here complaining about it. I'm actually trying to do something about it. So I thank each and every one of you that's either invested in Rivero or has signed up as a patient. I think we're going to be wildly successful, and I think we're going to do what needs to be done, what's sorely missing in this country and others. So stay tuned for that, guys. You guys have a wonderful day. We'll talk to you soon.